Welcome to this quick guide on precision medicine, cancers you can inherit.
Genes carry the information that pass on traits that can be inherited from parents to children. Chemically, a gene is made of DNA. Genes tell your cells what to do. Some genes tell your cells when to grow and divide. Others tell your cells when to stop growing and dividing.
Your body adapts to the world by turning genes on or off. Genes may be turned off or on in response to things like changes in your diet or your environment. When there is a change in a gene, it's called genetic mutation. In cancer, genetic mutations can occur in your genes or in the cancer's genes. Mutations in your genes are inherited from your parents and can be passed on to children. These are called inherited mutations. Very small changes in the DNA can sometimes cause large issues like cancer. What is inherited is a mutation or change in your genes that increases your risk of cancer. It's not the cancer itself that is inherited.
About 5 to 10% of all cancers are linked to an inherited mutation from their birth father or their birth mother. Types of cancers most often traced back to genetic mutations you can inherit are breast cancer, colorectal cancer, ovarian cancer, pancreatic cancer, stomach cancer, and uterine cancer. But there are also others.
If you or a relative has one of these types of cancer, it doesn't mean you have to test for a genetic mutation. Testing for a genetic mutation that you inherit does not automatically mean cancer. Most cancers are not inherited. However, if your family does have a history of a cancer-related gene, this means more careful screening in the future for family members to find any abnormal growths early.
Talk to your doctor or a genetic professional if you are interested in getting tested. They can help you decide if genetic testing makes sense for you. A genetic professional can include a genetic counselor or other healthcare professional that is trained to help you choose if testing is right for you. If you get tested, they can also explain your results.
Blood or saliva samples are typically used to test for inherited genetic mutations.
Testing positive for an inherited mutation does not mean that you will develop cancer. It does mean that your risk of developing cancer is higher than it is for someone that does not have the genetic mutation. It can be scary to learn that your risk of developing cancer is higher than average, but by knowing you have the mutation, you may be able to take steps to reduce your risk. You can reduce your risk by seeing doctors who treat patients with an increased cancer risk, having additional or more frequent cancer screenings, quitting smoking, eating a healthy diet, taking certain medications, and consider options to remove the area where the cancer may develop.
Testing positive for an inherited genetic mutation does not tell you your exact risk for developing cancer or at what age you might develop cancer. However, it may tell you which types of cancer you might develop.
To understand more, let's listen to some first-hand experiences with genetic testing for hereditary cancer. I'm 30 years old and healthy. My mom and sister have both had breast cancer, and they recently tested positive for a mutation in a gene called BRCA2. Having this mutation puts women at higher risk of developing breast and/or ovarian cancer. Even though I've never had cancer, I decided to talk to a genetic professional. After that appointment, I decided that it made sense for me to get tested. The test showed that I have the mutation too. The genetic professional helped me deal with learning this and explained to me what it meant. Then we made a plan for reducing my risk over time. My husband and I plan to start our family soon. Once we have children, I'm going to consider surgery to remove breast and ovarian tissue from my body.
I'm 45 years old and in treatment for colon cancer. Since my mother had ovarian cancer, my doctor suggested that I speak with a genetic counselor. After meeting with the counselor, I chose to get tested for mutations linked to colon cancer. I learned that I have an inherited genetic condition from one of my parents called Lynch syndrome. People with Lynch syndrome have genetic mutations that increase their risk for several types of cancer. The genetic counselor helped me deal with learning that I have this condition. We also talked about how and when to tell my kids about it.
We noticed one of our daughter's eyes crossing at times. We thought it was just a lazy eye, but our pediatrician referred us to a specialist. Gayla was diagnosed with retinoblastoma, a cancer that begins in the back of the eye. Children who don't inherit it only develop a tumor in one eye. Since she was diagnosed with it in both eyes, we were fairly sure that it was hereditary. Our doctor arranged genetic counseling for us. The counselor explained what the risk might be for Gail, and for our Gail's soon-to-be-born little sister. Should Gail test positive for the genetic mutation that's linked to retinoblastoma, we decided to go ahead with testing, just to be aware how closely we should be monitoring our children going forward. Should any other types of cancer develop in Gail or her little sister, we want to catch them as early as possible.
There are two types of genetic testing that you might consider. The first is testing to see if you inherited a mutation that increases your risk of getting cancer when you have no diagnosis of cancer. This is called genetic testing for an inherited cancer risk. The second type is testing to see if you inherited a mutation that increased your risk of the cancer you were diagnosed with. This is called genetic testing for an inherited mutation. These are both different from biomarker testing. Testing for cancer biomarkers is done to find out more about your cancer. Biomarker testing helps your doctor match the right drugs to the specific subtype of cancer you have. The test looks for biomarkers in your cancer sample. The test results can be used to help guide your treatment options. To learn more about testing for cancer biomarkers, see our e-learning quick guide on biomarker testing. To learn more about genetic testing, see our genetic testing booklet.